through Medicaid expansion, then went back to work, and now they're on private insurance. So those are some facts about Medicaid that you might want to brush up on. Now, I'm also extremely concerned about your endorsement of radical fringe conspiracies that, if implemented at HHS, would put American families' lives at risk. Vaccines are one of our greatest public health triumphs. And you don't need, I'm not talking about abstract medical science. One of the people who helped raise me was my grandfather, who was a pediatrician. He practiced medicine in this country from 1921 until the mid-1980s. And I heard details about the difference those vaccines made in saving lives in the children who were under his care. Vaccination has helped to eradicate many deadly diseases in the United States, including polio and smallpox, something we should be proud of as Americans. I am extremely concerned that as Secretary, you would be able to halt critical vaccine research and to exploit parents' natural worries by advising them not to vaccinate their children. This will lead to more children getting sick, and some will even die. Before the measles vaccine, about 500 American children died a year from measles. This is too much of a risk for our country, and there is no reason that any of us should believe that you have reversed the anti-vaccine views that you have promoted for 25 years. For example, you have previously falsely suggested that the polio vaccine killed many, 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 many more people than polio ever did by causing fatal cancers, while rigorous safety studies show that to be completely false. Now, let's go to something we agree upon. I am really heartened to see that one area where we agree on is on women's reproductive freedom. In your own words, it's not the government's place to tell people what to do with their bodies. You said that, correct? Yeah. Mr. Kennedy, in 2023, you came to New Hampshire and said, quote, "I'm pro-choice. I don't think the government has any business telling people what they can or cannot do with their body." So you said that, right?
Yes.
Yep. But you also said we need to trust the women to make that choice because I don't trust government to make any choices. You said that too, right?
Yes.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right, so, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that regardless of what you believe, regardless of what values you have, if President Trump tells you to do something, you're going to do it. You said just now the discussion about mifepristone. Oh, he's asked me to study the safety of it. Here are the safety studies that tell us mifepristone is safe and effective. And I asked Mr. Chair that these about 40 studies be admitted to the record by unanimous consent.
Without objection.
So the studies are there. The safety is proved. The science is there. But what you're telling us is if President Trump orders you to take action to make it harder for women to get direly needed health care, you'll follow his order. If Mr. Trump, as he did yesterday, orders a halt on Medicaid payments that are essential for taking care of people with disabilities all around this country, you're going to follow that order because you are willing to sacrifice your values, your knowledge, if President Trump tells you to do that. That, to me, is unacceptable in a Secretary of Health and Human Services.
As I explained before, the White House has issued a statement saying that that policy will not deprive any American of benefits.
The problem is the White House issued that statement only after we pointed out the damage it would do, and it became politically uncomfortable for them. You know what else that freeze on federal funding did? It halted funds for critical research that could cure pediatric cancer. So if the president tells you to do that, you're going to stop that too. That's enough.
Thank you. Senator Cortez Masto is next.
Thank you. Mr. Kennedy, thank you for coming into my office and having the conversation that we did. I appreciate your passion and your belief, and you've spent years really talking about the issues that matter to you, and I appreciate that. Let me ask you a couple of questions, though I just need some clarification. Right now, there's a 40-year-old law that requires hospital ERs accepting payment from Medicare to actually provide emergency care to patients. So let's say a woman experiencing a life-threatening condition like a heart attack goes to the ER. As a lawyer, you would agree that that federal law protects her right to emergency care, correct?
Yes.
So now a pregnant woman with life-threatening bleeding from an incomplete miscarriage goes to the ER. Let me rephrase that so you can hear. A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned. You would agree also as an attorney that federal law protects her right to that emergency care, correct?
I don't know. I mean, the answer to that is I don't know. If the state bans
well, let me ask you this as an attorney. Doesn't federal law preempt state law?
The federal Constitution does. Sometimes not every federal law preempts state laws. It could be unconstitutional. I'm not trying to be evasive,
in this case, let me
Senator.
ask you this.
I'm just telling you I don't know the
I
answer
appreciate
to that question.
But what authority do you have over this as the director of HHS?
What authority do I have?
To enforce the law.
In what regards?
To make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients when they present. It's actually the EMTALA law. So what authority as HHS director do you have with respect to EMTALA?
My understanding is that I have budgetary power and that it's pretty much limited to that. But if you tell me I have another authority, I don't even think that.
Well, let me tell you,
we have a law enforcement branch at HHS.
Actually, you do, and that's CMS. CMS actually investigates complaints of EMTALA violations, as well as the Health and Human Services Inspector General, who, by the way, was just recently fired by Donald Trump. So you will be enforcing EMTALA laws, and it's important that you understand their impact and don't play politics with the patient presenting at the ER based on a position that this administration has taken. Let me ask you another question. When we met in my office, you said about lowering drug prices, that when Big Pharma price gouges, the American people suffer. I think we both agree on that. And I think you're sincere in your belief that you want to reduce prices for Americans, correct?
Yes.
Yeah. The Inflation Reduction Act empowered Medicare to negotiate prescription drug prices. It penalizes drug companies for price hikes above inflation, and it caps seniors' out-of-pocket drug costs, along with reducing insulin prices to $35 per month. But your future boss, Donald Trump, on his first day in office, revoked President Biden's executive order that actually directed the health secretary to examine ways to reduce drug prices and improve access to innovative therapies for the American people. And unfortunately, Republicans in Congress to repeal the Inflation Reduction Act, which means reversing all of those things that we worked on to lower prices for Americans. So my question to you is, what do you do? Why are you there? Are you there to be a rubber stamp to this administration and cave into all of these positions that they're taking, even though you know they're in disagreement with your positions on lowering drug prices and that they could harm Americans? How do you handle that as HHS director?
Senator, my understanding is that the White House issued an executive order, I believe today, supporting the drug negotiations under the IRA. President Trump was very aggressive during his first term about negotiating drug prices. He has instructed me, and I've met with him repeatedly as that we need lower prices than seniors in this country, and
so let me ask you. Let me ask you this, because I only have so much time. So we've already negotiated lowering prices for 10 drugs with Big Pharma, and Big Pharma, by the way, opposes this. They have not only are asking for a pause, they have filed lawsuits, but we've already negotiated the first 10 drugs. And we want to expand it to the next 10 to 15 that the Biden administration has put forward. Would you agree and continue that path of really mandating that Big Pharma come to the table and negotiate drug prices for Medicare so we can lower those prices for Americans?
My understanding is that the executive order that was issued today, which I haven't seen, but I've read a summary.
Well, let me ask you this then, because you keep citing the Trump administration and you're just going to follow what they say. Is that what you're doing? You're just a rubber stamp for them in this position? So anybody, so it doesn't matter that you're before us. It could be anybody coming before us as long as they're a rubber stamp for this administration and disregarding your beliefs and what you think. I guess my question to you is, if it really is fundamental to what you believe, how do you live with that? How do you address those issues moving forward, knowing that it's going to harm Americans? Yeah.
You want me to answer the question?
No, I'm asking you.
Okay. President Trump has asked me to end the chronic disease epidemic and make America healthy again. And
so is that the only reason why you're at HHS? Is that the only reason why then you're at the HHS, to address that one issue?
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying, and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically, to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.
Senator Barrasso.
Thanks so much, Mr. Chairman. Mr. Kennedy, thank you for taking time to visit with me in my office prior to today's hearing to talk about a lot of the important issues affecting healthcare in my home state of Wyoming, as well as the nation. And I appreciate your willingness to serve our country. During our meeting, we discussed the challenges that healthcare providers and patients are facing in rural America, financial obstacles facing rural hospitals, workforce shortages, issues of OBGYN, and then new regulations that are painful that have come out of the Biden administration, hurting our ability to provide nursing home staffing. So let me start, if I could, with rural hospitals and the closures of hospitals like that. There are a lot of challenges facing hospitals in rural communities and frontier areas. We have 33 hospitals in Wyoming. 26 are really located in various locations, often hard to get to. Weather impacts them. 6 of the hospitals are at risk of closing. 2 are at immediate risk of closing in the next 2 years. 10 have had to cut available services. And this is a concern of rural hospitals in both Republican and Democrat states, either way, bipartisan. Critical that the workforce challenges, financial challenges that we're facing are addressed. Can you commit to working with us on a plan to address the critical nationwide issue of rural health care?
Yes, yes, Senator. And I would say that during my visits, I visited almost 60 senators so far. And the most common unifying, I would say, issue among both Democrats and Republicans, there were two. One was PBM reform, and the other is rural hospitals. And you know, our nation made a commitment over 100 years ago to put up a hospital within 30 miles of every American. We generally succeeded in doing that. It's absolutely critical. It's life-saving. And rural hospitals are closing at an extraordinary rate right now. They not only provide important health care for the localities, but also they're economic drivers for localities all over this country. President Trump is determined to end the hemorrhage of rural hospitals, and he's asked me to do that through the use of AI, through telemedicine, which these are innovations that I saw the other day. A Cleveland clinic has developed an AI nurse that you cannot distinguish from a human being, that has diagnostics as good as any doctor. And we can provide concierge care to every American in this country, even the remote parts of Wyoming, Montana, Alaska, et cetera. We also have opportunities at HRSA and at the GME to finally live up to GME's mission of providing personnel to rural hospitals. And I intend to use all of my power, because I've seen the priority that is given by both Democrats and Republicans on this committee. I intend to make that a priority if I'm privileged to be confirmed.
Well, I appreciate it, because often with financial strains on a local hospital, one of the common services to be cut in rural hospitals and maternity services. And now we have women in Wyoming having to drive over 100 miles to access care. 13 counties in Wyoming don't have access to OB. And we're talking counties larger than the states of Vermont, New Hampshire, Rhode Island, Connecticut, New Jersey, Delaware, counties larger than those whole states. So will you commit to working with my office to find solutions to help address these specific maternal health challenges in rural America?
Yes, Senator, I look forward to it.
Another issue we specifically spoke about with this harmful Biden administration rule that have really been bad for our rural nursing homes. And it's a rule that would triple the registered nurse requirements in nursing homes. This is going to lead, there just aren't enough registered nurses in our state to be able to comply with this. This would lead to nursing home closures across our state. Will you commit to working with me to fix this serious problem as a result of a rule that came out by the Biden administration, who clearly doesn't understand rural America?
Yes, Senator, I think the rule was well-intentioned, but as you've said, and I've heard from many rural senators, it will be a disaster for their states. Some of the nursing homes, these are staffing rules that require 24-hour staffing by medical professionals. Some of the nursing homes in rural areas simply do not have the available personnel or the economics to be able to do that. It will mean the closure of nursing homes in rural areas across our country, which means the parents, the elderly parent, will be moved a great distance from the local community and their family. And we know that the single greatest driver of high-quality nursing home care is the involvement, the proximity of family members. When you move that nursing facility away from the community where the kids live, you're going to get much worse care. So the intention, although it was noble, was in reality, for rural areas at least, it is going to be a disaster.
Thank you. Thank you, Mr. Chairman.
Thank you. Senator Johnson.
Mr. Kennedy, welcome. Thank you for being here. Thank you for your decades-long advocacy for a clean environment, for children's health. I can't say as I'm surprised by the hostility on the other side. I'm highly disappointed in it. I don't know if you remember when you called me up and you were contemplating setting your political differences aside, joining forces with President Trump on an area of agreement, addressing chronic illness, trying to find the root cause of all these problems facing this nation. My first response was, Bobby, this is an answer to my prayers. We need to get to the answers of this, but even more, we need to heal and unify this divided nation. I'm not necessarily the most optimistic guy because we've got enormous challenges facing this nation, but I thought, wow, here's somebody from the left, somebody I don't agree with on many issues politically, coming together with President Trump and focusing on an area of agreement, something that the American people desperately want. Finding out the answers. What has caused autism? What is causing chronic illness? Ms. Kennedy, I think I've come to know what's in your heart. I think I know the personal and political price you've paid for this decision. I want to say publicly, I thank you for that. I truly appreciate what you're doing here. Can't we come together as a nation and do this? Can we do? Aren't you getting tired of this? I'm getting tired of this. So again, Mr. Kennedy, I need to enter in the record. These are just 11 letters of support signed by 63,000 people, thousands of doctors. From the American Association of American Physicians and Surgeons, Independent Medical Alliance, the North Carolina Physicians and Freedom Group, Governor Jeff Landry from Louisiana. These are Americans, nonpartisan. A lot of these people, I know because I've advocated with you. A lot of them are Democrats. They put their political differences aside. So, Mr. Chairman, I'd like to enter this in the record.
Without objection.
I also do want to, Mr. Kennedy, as long as I have you here, I've written over 70 oversight letters to the federal health agencies under the Biden administration. I've virtually gotten squat them, okay? What I get is we get, for example, 50 pages of Anthony Fauci's emails redacted. Oh, by the way, the latest one was 17 pages. Instead of issuing a health alert on the myocarditis they knew was impacting young men early in 2021, instead of issuing an alert on the Health Alert Network, they developed 17 pages of talking points. This was given to the public under a FOIA request. They had to go to court. They've got a new way of redacting. They don't black things out. They just give you white pages, so you don't even know what they have redacted. So again, I've issued a subpoena now to cover the information I've requested in 70 oversight letters. My question to you is, as Secretary of HHS, will you honor these requests from Congress, and will you make HHS transparent?
Yeah, my approach to HHS, as I said before, Senator, is radical transparency. Democrats and Republicans ought to be able to come in and get information that was generated at taxpayer expense, that is owned by the American taxpayer. They shouldn't get redacted documents. Public health agencies should be transparent. And if we want Americans to restore trust in the public health agencies, we need transparency. I want to say something about what you first said. When I launched my campaign, it was about uniting Americans, Democrats and Republicans. There's no issue that should unite us more than this chronic health epidemic. There's no such thing as Republican children or Democratic children. These are our kids. 66% of them are damaged. I know what a healthy kid looks like because I had so many of them in my family. I didn't know any of the food allergy growing up, peanut allergy. Why do 5 of my kids have allergies? Why are we seeing these explosions in diabetes, rheumatoid arthritis, neurological diseases, depression, all of these things that are related to toxics in the environment? Why can't we just agree with each other to put differences about so many issues, intractable issues aside, and say, we're going to end this? I don't think anybody is going to be able to do this like I have because of my peculiar experience because I've litigated against these agencies. When you litigate against them, you get a PhD in corporate capture and how to unravel it. I've written 6 books about these agencies. I know a lot about them, and I know how to fix it. And there's nobody who will fix it the way that I do, because I'm not scared of vested interest. I don't care. I'm not here because I want a position or a job. I have a very good life and a happy family. This is something I don't need. I want to do this because we're going to fix it. And the other thing is we are attracting now a caliber of people to HHS like never before in history. And they're entrepreneurs, they're disruptors, they're innovators of immense talent that are walking away, many of them from growing concerns. They're not coming there for position. They're coming there because they want to save our country. And they're from across the political spectrum. And all these Democrats are opposed to me for partisan issues. They used to be my friends, agreed with me on all the environmental issues that I've been working on for my whole career. Now they're against me because anything that President Trump does, any decision he makes, has to be lampooned, derided, discredited, marginalized, vilified.
We need to move on. Senator Warren.
Thank you, Mr. Chairman. So, Mr. Kennedy, I want to start with something that I think you and I agree on, and that is that Big Pharma has too much power in Washington. You've said that President Trump asked you to, quote, clean up corruption and conflicts. Sounds great. You've said that you will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an easy question. Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member?
Can you just repeat the last part of the question? Can I commit
You're
to
not
what?
going to take money from drug companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh. Yeah, I'm happy to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this question.
I don't think any of them want to give me money, by the way.
Let's keep going. You're right because to say yes, because every American has the right to know that every decision you make as our #1 health officer is to help them and not to make money for yourself in the future. So I want to talk more about money. I'm looking at your paperwork right now. In the past 2 years, you've raked in $2.5 million from a law firm called Wisner Baum. You go online, you do commercials to encourage people to sign up with Wisner Baum to join lawsuits against vaccine makers. And for everyone who signs up, you personally get paid. And if they win their case, you get 10% of what they win. So if you bring in somebody who gets $10 million, you walk away with $1 million. Now, you just said that you want the American people to know you can't be bought. Your decisions won't depend on how much money you could make in the future. You won't go to work for a drug company after you leave HHS. But you and I both know there's another way to make money. So, Mr. Kennedy, will you also agree that you won't take any compensation from any lawsuits against drug companies while you are secretary and for 4 years afterwards?
Well, I'll certainly commit to that while I'm secretary. But I do want to clarify something because you're making me sound like a shill. I put together that case. I did the Science Day presentation to the judge on that case to get it into court.
Mr. Kennedy,
hearing.
Mr. Kennedy, it's just a really simple question.
Yeah,
You've taken in $2.5 million. I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your rake out of that while you're a secretary and for 4 years after. It's just...
I'll commit to not taking any fees from drug companies while I'm secretary.
No. I'm asking about fees from suing drug companies. Will you agree not to do that?
You're asking me to not sue drug companies,
No,
and I'm not going to agree to that,
you can sue drug
Senator.
companies as much as you want.
I'm not going to agree to not sue drug companies or anybody.
So let's do a quick count here of how, as Secretary of HHS, if you get confirmed, you could influence every one of those lawsuits. Well, let me start the list. You could publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by. You could appoint people to the CDC vaccine panel who share your anti-vax views and let them do your dirty work. You could tell the CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up manufacturers to mass torts. You could make more injuries eligible for compensation, even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits. You could turn over FDA data to your friends at the law firm, and they could use it however it benefited them. You could change vaccine labeling. You could change vaccine information rules. You could change which claims are compensated in the vaccine injury compensation program. There's a lot of ways that you can influence those future lawsuits and pending lawsuits while you are Secretary of HHS. And I'm asking you to commit right now that you will not take a financial stake in every one of those lawsuits so that what you do as Secretary will also benefit you financially down the line.
I'll comply with all the ethical guidelines.
That's not the question. You and I, you have said
You're asking me, Senator, you're asking me not to sue vaccine pharmaceutical companies. Yeah, you are. That's exactly what you're doing.
Look, no one should be fooled here. As Secretary of HHS, Robert Kennedy will have the power to undercut vaccines and vaccine manufacturing across our country. And for all of his talk about follow the science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about then say you won't make money off what you do as Secretary of HHS?
Before we go to Senator Tillis, I think it would be important for me to make it very clear that Mr. Kennedy has gone through the same Office of Government Ethics process as every single other nominee in the Finance Committee this year and in previous administrations. In addition to listing his assets, including the items that you've identified, he has signed an ethics letter that has been reviewed by the Office of Government Ethics concerning any possible conflict in light of its functions and the nominee's proposed duties. And we have a letter from the Office of Government Ethics that he hasn't complied completely with all applicable laws and regulations governing conflicts of interest.
Mr. Chairman, point of information here. Have we had a single nominee come through who's made $2.5 million off suing one of the entities that it would be regulating and plans to keep getting a take of every lawsuit in the future? Have we had that before?
I haven't reviewed the past documentation of every other nominee's financial interests, and so no. But I know that every single time we get a nominee, their financial interests are attacked. That's why we have the Office of Government Ethics. That's why they've reviewed everything that's in his record, and that's why he has even, I think, and I don't know that I want to ask him to get into it, but he has listed his assets and has gone through a discussion of the responsibilities under our ethics laws and is complied with all of those requirements. Senator Tillis.
Thank you, Mr. Chairman. Mr. Kennedy, how's your morning going?
So far, so good, Senator.
You came prepared. I'm glad that you did. I believe, addressed to my satisfaction a question about Title X and the president's priority with respect to Planned Parenthood. Can you just affirm that you are 100% behind the president's policy on Title X and the implementation?
I'm 100% behind it, Senator.
Thank you. You know, it's amazing to me that people, well, first off, you need to understand I was in a judiciary hearing this morning. It's very clear to me that some of these nominations are going to be shirts and skins. So no matter what you answer in the affirmative, they're going to ask you one more question so that you won't be able to answer in the affirmative. That's just the way the game gets played when we have nominees like yourself. So I think you're handling yourself well. I got a real quick question for you. Are you a conspiracy theorist?
That is a pejorative, Senator, that's applied to me, mainly to keep me from asking difficult questions of powerful interests. I was told that I was a conspiracy theorist. That label was applied to me because I said that the vaccines, the COVID vaccine, didn't prevent transmission and it wouldn't prevent infection, when the government was telling people, Americans, that it would. I was saying that because I was looking at the monkey studies in May of 2020. I was called a conspiracy. Now everybody admits it. I was called a conspiracy theorist because I said red dye caused cancer. And now FDA has acknowledged that and banned it. I was called a conspiracy theorist because I said fluoride lowered IQ. Last week, JAMA published a meta-review of 87 studies saying that there's a direct inverse correlation between IQ loss.
All right, so I'm going to assume
I could go on for about a week.
So is there any one of them that you can say, you got me, that really was a conspiracy theory, or are you in a position to submit for the record? I think it'd just be helpful for every one of these narratives for you to submit that maybe for the record. You said something about SNAP lunch. I was in the State House in North Carolina before I came here, and anytime I'd go visit an elementary school, the first thing I would do is go to the trash cans in the cafeteria. And what we have now are kids that are not eating food because the dictates of the federal government have made it something that they don't want. But they say, well, it's a healthy alternative. It has processed materials in it, and it's not particularly attractive to them. So they throw it away. Trash cans full of food that these kids didn't eat. So then what do? They go eat snacks, or they go eat or they drink a sugared drink. The SNAP program, everything you've said about the SNAP program, I agree with. I think that we should be very, very strict about that. And it's going to make some people uncomfortable in the food manufacturing segment, produce healthy foods that we can put in the SNAP program. That's the way to address it. But we also need to look at the school health program. I was PTA president 21, 22 years ago at my daughter's high school. And I feel like we've got these kids that need help. We've got to guide them through a process. Many of them are probably on Medicaid, and Medicaid's failing them. Everybody here says Medicaid is sacrosanct. Nobody's admitted that Medicaid is not producing positive health outcomes. Is that your problem in Medicaid right now, the program or the outcomes?
Is the outcomes. We're spending $900 billion, and our people are getting sicker every single year.
Yeah, so anybody
and President Trump wants people to have it, Americans to have high-quality insurance.
Anybody who's building a case for the status quo of Medicaid is by extension saying that they're happy with the outcomes. I think it's unacceptable. I do have a question for you on Project Warp Speed. We supported the CARES Act. We had 97 people in the U.S. Senate vote for it. Everybody here. There was only one member of Congress that voted against it, I believe. And Project Warp Speed had CDC, FDA, NIH, and BARDA very much in the mix. Now, some people think that you're going to come in here and insert yourself into those agencies in a way that's never been done before. Let's say that they're a part of a future Project Warp Speed. Is it your intent to go in and do something that's never been done before based on my staff's research and insert yourself in a discussion that the scientists are dealing with in those different agencies?
No, Senator. What I want to do is, I'm not a scientist. I want to empower scientists. I want to make sure that science is unobstructed by vested or economic interests.
That's good.
Or by bad culture. And I'll just say about Operation Warp Speed, it was an extraordinary accomplishment, demonstration of leadership by President Trump. When he promoted Operation Warp Speed, he was looking at all of the different remedies, including vaccines.
Therapeutics, everything.
Therapeutic, ivermectin, hydroxychloroquine, famotidine, even chlorine dioxide, and he was not looking at shutting down our country for the year, forcing people to wear masks for a year, forcing all social distancing that did not have any scientific basis, which Dr. Fauci has now acknowledged. He said, we took it out of thin air. But all of those changed during the Biden administration. And it became very narrowly focused. We ended up with the worst, the highest death count of any country in the world.
Mr. Chair, if I can just ask one final question, and I think it's a one-word answer. I've heard a lot of people complaining about health care delivery, Medicaid. On the other side of the dais here, who's been responsible for health care policies over the last 4 years?
The Biden administration.
I mean, the president, the Biden, okay.
Yeah.
So that, I'd like to have heard more of those in oversight hearings over the last 4 years. I haven't, but I'm glad that there's an acknowledgement that you're inheriting a problem that needs to be fixed. Thank you.
Thank you, Senator.
Senator Sanders.
Thank you, Mr. Chairman. Mr. Kennedy, thanks for being with us. I very much like the slogan that you coined, Make America Healthy Again. And I strongly agree with that effort. Despite spending, as you indicated, 2 or 3 times as much capital on healthcare as other nations, we have 85 million people who are uninsured, underinsured. We have all kinds of chronic illnesses. Our life expectancy is lower than other countries. And for working class people in this country, they are living 6, 7 years shorter lives than the top 1%. We got a problem, okay? And I'm gonna suggest some ideas that I think can remedy that. Last year, the insurance industry in this country made over $70 billion, while at the same time, 85 million Americans are uninsured or underinsured. Do you agree with me that the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes? No?
Senator, I can't give you a yes or no answer to that question.
Health care a human right? Is health care a human right?
In the way that free speech is a human right,
yeah.
I would say it's different because with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool. Well, and so are you guaranteed the same right, or is there also a duty?
I'm sorry, I'd love to talk for an hour with you. We got a few minutes left here. All right, every other country on earth says healthcare, whether you're poor or rich, young or old, is a human right. I'm not hearing you say that. All right, you've talked about the drug companies, and maybe we agree on this one. As you all know, despite the drug companies making over $100 billion in profits, paying CEOs outrageous compensation packages, we in some cases pay 10 times more for the same drug. Will you support legislation that I will introduce which says that in America we should not be paying a nickel more for prescription drugs than people around the rest of the world?
To equalize it?
Not to equalize it, that we should not be paying more than other countries for the same damn drug.
President Trump has asked me, in fact, I had a meeting with President Trump a week ago where we showed him the charts.
He knows the charts.
We're paying 10 times more from Europe.
That's right. And are you going to commit to us that you will end that absurdity?
I think in principle we can. We should end that disparity.
Good. Okay. That's great. All right. I happen to believe that climate change is real, it's an existential threat, and it is a healthcare issue. Donald Trump thinks that it is a hoax originating in China. Question is, in your judgment, is climate change a hoax or is it real, causing devastating problems?
President Trump and I, from the beginning, from our first meeting, agreed to disagree on that issue. I believe climate change is existential. My job is to make Americans healthy again.
All right, you believe that you disagree with Trump, you don't think climate change is a hoax, is what I'm hearing.
My job here is to make
I'll just ask you that, Mr. Kennedy, not a trick question.
I answered your question, Senator Sanders.
Okay, you disagree with the president on that?
I answered your question.
Okay. I'm going to pick up on a point that Senator Hassan made. Look, there is no question that abortion is a divisive issue in this country. I would say a majority of the people are pro-choice. There's a strong minority who are pro-life. A year and a half ago, you went to New Hampshire, running for president, gave a speech, and you talked about government should not tell a woman what she can do with her own body. That's her choice. Now, I think everybody on that side is pro-life. I think everybody here is pro-choice. I have never seen any major politician flip on that issue quite as quickly as you did when Trump asked you to become HHS secretary. Tell me why you think people should have confidence in your consistency and in your word when you really made a major U-turn on an issue of that importance in such a short time.
Senator, I believe, and I've always believed, that every abortion is a tragedy.
But you told the people in New Hampshire that it was their right. All right, let me do a last question here because I'm running out of time. I think the gist of what you're trying to say today is you're really pro-vaccine, you want to ask questions. You have started a group called the Children's Health Defense. You're the originator. Right now, as I understand it, on their website, they are selling what's called onesies. These are little things, clothing for babies. One of them is titled Unvaxxed, Unafraid. Next one, and they're sold for $26 a piece, by the way. Next one is No Vax, No Problem. Now, you're coming before this committee and you say you're pro-vaccine. Just want to ask some questions. And yet your organization is making money selling a child's product to parents for $26, which casts fundamental doubt on the usefulness of vaccines. Can you tell us now that you will, now that you are pro-vaccine, that you're going to have your organization take these products off the market?
Senator, I have no power over that organization. I'm not part of it. I resigned from the board.
Yeah, that was just a few months ago. You founded that. You certainly have power. You can make that call. Are you supportive of this?
I've had nothing to do with leadership.
Are you supportive of these onesies?
I'm supportive of vaccines.
Are you supportive of this clothing, which is militantly anti-vaccine?
I am supportive of vaccines. I will. I want good science and protect.
But you will not tell the organization you founded not to continue selling that product. Thank you, Mr. Chairman.
Senator Blackburn.
Thank you so much, Mr. Chairman, and thank you so much for being with us today. And I have no doubt that you will be confirmed and you are going to do such a solid job for the people of this country. And I do have several issues I wanted to talk with you about and didn't have time to cover them all when we met prior to the meeting, but rural health care is very important to me and the people of Tennessee. 78 of our 95 counties are rural counties. Now, over the last few years, we've seen hospital closures. So we have focused on access in rural areas. And my rural health agenda, which is bipartisan, focuses on innovation, telehealth, access points. It focuses on work shortages, and also Senator Warner and I have together focused on making certain that we address the area wage index and do that fairly for our citizens that are in rural communities. So I would like a commitment from you that